Caribbean leaders push back against U.S. scrutiny of Cuban medical missions amidst Senator Rubio's regional visit. The Caribbean is bracing for a high-stakes visit from U.S. Senator Marco Rubio, a vocal critic of Cuba's medical missions, as regional leaders vehemently defend the program and reject accusations of human trafficking. The upcoming visit, scheduled for Wednesday, follows Rubio's February announcement expanding a U.S. policy targeting forced labor and abusive and coercive labor practices, allegedly associated with Cuba's overseas medical personnel. This has sparked a heated debate in the Caribbean, with several nations strongly contesting the U.S. accusations. Prime Minister Ralph Gonsalves of St. Vincent and the Grenadines, SVG, speaking ahead of Rubio's visit, expressed confidence in dispelling U.S. concerns. He asserted that SVG has provided irrefutable evidence to the U.S. government demonstrating that Cuban medical professionals working within the country are not victims of human trafficking. This decisive action underscores SVG's commitment to upholding the integrity of its partnership with Cuba and refuting the allegations leveled by Senator Rubio. Gonsalves' statement carries significant weight, given the long-standing collaboration between SVG and Cuba in the realm of healthcare. This partnership, like many others throughout the Caribbean, has proven invaluable, particularly during times of crisis. The unwavering support provided by Cuban medical professionals has been instrumental in strengthening healthcare infrastructure and responding effectively to significant public health challenges. The assertion that these dedicated individuals are involved in any form of human trafficking is not only insulting, but also profoundly misrepresents the reality of the situation. The accusations levied by Senator Rubio, while seemingly focused on labor practices, strike at the heart of Caribbean-Cuban relationships. These relationships, built on mutual respect and shared goals of improving healthcare access, are now being challenged by a narrative that many regional leaders perceive as unfounded and deeply damaging. The reliance on Cuban medical professionals, particularly during critical periods such as the COVID-19 pandemic, has been openly acknowledged by Caribbean nations. The contribution of these dedicated healthcare workers cannot be overstated, and to label them as victims of human trafficking undermines their significant contributions to the well-being of countless individuals. Barbados Prime Minister Mia Mottley, current chair of CARICOM, provided a compelling testament to the crucial role played by Cuban medical personnel. She candidly admitted that Barbados, despite not currently employing Cuban medical staff, would have struggled to navigate the COVID-19 pandemic without their assistance. This statement highlights the broader regional reliance on Cuba's healthcare expertise and the potential ramifications of undermining this valuable collaboration. The upcoming CARICOM meeting, held on March 21st, addressed Senator Rubio's visit and the broader implications of the U.S. policy shift. While a statement from Trinidad and Tobago indicated a focus on U.S. foreign policy and its regional impact, the specific inclusion of the Cuban medical mission issue remained unconfirmed. However, Prime Minister Gonsalves anticipates that Caribbean governments will directly address this contentious issue during bilateral meetings with Senator Rubio in Jamaica, Trinidad and Tobago, Guyana, and Suriname. Senator Rubio's family history, as the child of Cuban immigrants, adds another layer of complexity to the situation. While his concerns regarding human rights are understandable, the blanket condemnation of Cuba's medical missions risks overlooking the positive impact these programs have had on healthcare access and infrastructure in numerous countries. The stark contrast between the Caribbean nations' perspective and the U.S. stance necessitates a deeper, more nuanced understanding of the situation. The unwavering support for the Cuban medical missions by Caribbean leaders isn't merely a matter of convenience. It reflects a genuine appreciation for the invaluable contribution these medical professionals have made, particularly during times of crisis. The accusations of human trafficking, therefore, are not only factually disputed, but also represent a significant challenge to the strong, collaborative relationships that have fostered improvements in healthcare delivery across the Caribbean. This unfolding situation highlights the complexities of international relations, particularly when intertwined with humanitarian issues. The upcoming meetings between Caribbean leaders and Senator Rubio will be crucial in fostering open dialogue and understanding, aiming to resolve the existing misunderstandings and ensure the continuation of vital healthcare partnerships that have demonstrably benefited countless individuals across the region. The rhetoric surrounding this issue necessitates careful consideration, balancing concerns about human rights with the need to acknowledge the positive impact of Cuba's healthcare initiatives in the Caribbean and beyond. The true test lies in finding a path forward that respects both human rights and the critical role played by Cuban medical professionals in improving healthcare access throughout the Caribbean. The ongoing debate demands a thorough examination of facts, a commitment to open dialogue, and a recognition of the shared goals of enhancing healthcare outcomes for the people of the Caribbean.